Hello, I'm Wayne Bergeron, and I'm an associate professor here at the University of North Alabama, and I teach criminal justice and security and emergency management. I want to welcome you to our second installment of So You Know, where we're going to talk about contagion mapping and contact tracing as it relates to the coronavirus and COVID-19. So if you've been watching the news or you've been searching online, you've probably come across a map that might look like something like this. And at the basic level, this is contagion mapping. Obviously, a map can give us lots of great information, and when it comes to a contagion or an outbreak, that information can be very useful to emergency responders and public health officials as they map out operations and response. And so when we talk about contagion mapping does a number of things for us. The first thing it does is a geographic representation. Early on, it can show us the origin of the outbreak, and we saw that in Wuhan, China, early on back in December, where we saw the beginning of cases. As we move forward in time, the mapping that we do shows us connection and relationships. As people traveled, they came into contact with one another, we have more cases, that begins to develop, that begins to populate the map. What that does for us is it demonstrates spread and progression. That can be valuable as we begin to figure out where we need to respond, what we need to do in terms of resources. The spread and progression can be very valuable to us. The contagion map also helps us visualize scope and scale. You may have seen some of the products that are out there that kind of show who has more cases versus less cases. And that can also help us in terms of where do we need to put our resources. Layering is another technique we use in contagion mapping. A contagion map, a hotspot map if you want to call it that, is basically it's a graphic representation of a database. And there's a database that sits behind the map. And so you can actually go in using layering and you can decide what specific information, what detailed information you'd like to know. You click on a particular spot and it'll bring that information up. It'll tell you how many cases, where they're located, all of those kinds of things. That helps us ultimately in our situational awareness. It's a fancy word for knowing what the heck is going on. And that's what we're really trying to do with contagion mapping. And ultimately it helps us in our resource allocation and our response operations. So early on in this outbreak, Johns Hopkins University published what they call their global case map through their Center for Science and Engineering. And they've been maintaining this in near real time using World Health Organization and CDC data. And as you can see, it's populated across the world, showing the outbreak, the total number of cases. As I record this, we've just recently crossed into the over 200,000 cases. You can see the link down at the bottom, but you can actually get to this from searching on the internet as well. As I mentioned with layering, we can click on a specific spot. In this case, I clicked on Texas in the United States, and you can see there's 132 confirmed cases, unfortunately 2 deaths, and 130 active cases. A public-facing product like this, that's about the level of information we're going to get inside an agency such as the CDC. They would be able to use layers with much more information like people's names and where they live and all that kind of stuff as well, which again can be very useful. The state of Alabama, as we began to have cases last week, the Emergency Management Department at Jacksonville State University published their case map for the state of Alabama, and they've been maintaining that in near real time. As I record this, we have 39 cases. Luckily, no deaths. As we drill down, again, we can click on Jefferson County, Birmingham area, as we see here. We have 21 confirmed and active cases. Again, this can be very valuable. The link is here. You can go to the JSU main webpage and you can get to their COVID-19 page and get to this map as well. So we talked about contagion mapping. The next tool that we use in the outbreak and public health world is contact tracing. And so contact tracing basically it's like solving a puzzle. You start with one piece of it and you move to the other pieces. And so the first piece we start with is generally a case, a patient. Someone presents themselves at a hospital or emergency room, and they have a set of symptoms. We identify this set of symptoms may be a contagion or an outbreak. They're isolated. They begin to treating them, but somewhere in there, a public health professional is going to come and they're going to interview them. And that's where the contact tracing part begins. And what the public health folks are going to do then is they're going to go out. The second step is they're going to try to identify who this person has interacted with. Who are their family members, their close contacts, their neighbors, their friends, where do they work out, all of those kinds of things. And then the third step is once they do that contact tracing and they identify those contacts, they're going to isolate those folks, quarantine if you will, and we'll talk about the difference between quarantine and isolation, but they're going to wait and see, do these folks have symptoms? They're going to keep them away from other people out of an abundance of caution. And this is going on all over the country and all over the world, and it's one of the most effective steps in preventing disease progression and outbreak progression over time. It works incredibly well if we get to it early, less well once we begin to have more and more cases. So we said contact tracing works. Sick individuals identify their contacts and we go out, we isolate them. At some point as the situation grows larger, we then move to what's called community monitoring. And community monitoring is where we take communities that are affected, and we've done the best we can with contact tracing, and then we now are monitoring those communities. And as we're seeing throughout the United States and throughout the world, we're in some cases isolating communities, maybe travel restrictions, limiting travel between communities, all in an attempt to try to slow or stop the progression of the disease or the outbreak. Hopefully that's been useful. For more information about COVID-19, go to University of North Alabama has a COVID-19 information page. You can get to it from una.edu. It's right up at the top. You just click on it. President Kitts has actually recently put up a video talking about some of the things we're working on here at UNA. I highly encourage you to go and watch that as well. So the bottom line is we're going to get through this, at the local, the state, and even now at the federal level. We're beginning to do all the right things. We're putting into place those measures that are going to help us overcome this. So at the end of the day, keep calm, wash your hands, stay healthy and safe. We'll see you next time.